London Bridge Sports Medicine Podcast.
Hello and welcome to the LBSM podcast. Today I am joined by Julie Backley, who is a physiotherapist from the Institute of Sport, Exercise and Health. And today we are going to be talking about breathlessness. So essentially looking at people who are fit and healthy and why do they still feel breathless when they are exercising. So let me first introduce Julie, and she can give you a little bit of insight into who she is and what her role is as a respiratory physio. So welcome, Julie. It's lovely to have you on the show.
Well, thank you very much indeed for inviting me on to talk about breathing. So I'm a respiratory physiotherapist, and as you said, I work at the Institute of Sport, Exercise and Health, and I work alongside Professor Hull, and we run a respiratory clinic where we diagnose exercise-induced asthma, exercise-induced laryngeal obstruction, and breathing pattern disorders. So quite a specialist area when it comes to respiratory.
Yeah, and I think today what we're going to be focusing on is a little bit more about breathing pattern disorders, because athletes often have a problem with breathlessness, but they don't have a diagnosis. And so there's a sort of obviously a bit of a mismatch there. So let's just start with how someone can be objectively fit, but they still feel like they can't catch their breath.
Yeah. It's interesting, isn't it? Because, we define fitness as being able to perform and be able to do what we want to do to the best of our ability. But all of us do get breathless, and it's very normal. But we're not really always sure how breathless you should be. And so it's that idea around, is your breathing disproportionate to what you are currently doing? And, does it feel potentially uncomfortable, more uncomfortable than it should be, as breathlessness can feel like comfortable at high intensity exercise? Or is there an element of chest tightness, or just feels generally restricted and like it's not working for you?
Okay. And presumably your first port of call is to just make sure that there is no diagnosis. So you're involved a little bit in that side of things first. And then once they've sort of perhaps got the all clear in that department, you can then look at perhaps their breathing patterns a bit more.
Yeah, that is really important to get the accurate diagnosis. But often it overlaps. Sometimes people can have a diagnosis of asthma and also have a breathing pattern disorder. So you get that asthma.
Yeah, so that can be a bit more complex.
You get, and that's really common. We see that a lot. That their inhalers maybe are not working quite so well, and actually it's nothing to do with the asthma. It's the fact that they've got an issue with the way they breathe.
Okay, yeah, and presumably these patterns can develop over time. It's not sort of, it might be that or can it sort of suddenly come on if they've started changing their training, or how does it sort of present itself?
Usually more on a gradual basis. I don't think anyone breathes perfectly. We all live in a world where there's lots of different things that might change the way we breathe. And, if there's a period of time where your breathing hasn't been quite as efficient as you'd like it to be, and that happens repeatedly for all sorts of reasons, then your body can adapt into an inefficient way of breathing, which is ultimately where it can affect your performance.
Okay. And so if somebody came to see you, a runner or a cyclist, somebody in a sort of high performance sport, what are you seeing clinically when they're coming in and saying that they feel breathless?
Yeah. So the assessment process will look at the person and the athlete in different scenarios. So we always like to start at rest. And then we'll look at them also during their sport-specific exercise that they choose, because that's quite important in terms of positions. And when we're looking at the athlete when they are cycling or running or whatever it is, we're looking at the way they breathe, the sounds, where the air's going into. So we often see mouth, upper chest, gasping, high shoulder movements, lots of shoulders going up and down.
Up and down, yeah.
And you can, and often you can see the distress on their face too,
on the face.
along with that.
Yeah, okay. And so we were talking a little bit, I think, there about sort of chest breathing and diaphragm breathing. Is that correct?
Yeah, that's it. So we're always looking to see, the diaphragm is the main breathing muscle and it's what pulls the air into the chest. And so we often sort of divide the chest into two, this lower chest area, which is where the diaphragm is. And it is really a lot lower than we sort of think. It's around the bottom of your rib cage. So it's quite low
Yeah.
down in the waist area. And then you have your upper rib cage, which is the top part of your chest. And we often breathe more in the upper rib cage than the lower rib cage where the diaphragm sits. And really, where the diaphragm sits is where the most alveolar, where the most lung is. And where the most lung is where the most blood is. And the whole point of breathing is to get the oxygen into the blood.
Yeah.
So,
Okay.
it's at the bottom. All the action needs to be at the bottom of the chest. But
Okay.
we
I
see a
see.
lot of upper chest. It's not that upper chest breathing is wrong, but it should be predominantly in the lower chest area.
Okay. So that's a much more kind of efficient oxygen exchange. That's where that kind of goes on, is right in the bottom of the chest rather than, I
That's it.
see. And also, I guess when you're talking about chest breathing, you often sort of see people kind of like the gasping, the kind of neck muscles going, as you were talking about the shoulders up and down. So that would be a kind of pattern that you might see quite regularly, is it?
Yeah, we would. Exactly that. You're describing what we call the accessory muscles, and they're really important muscles, especially at high intensity exercise. And they're exactly that. They're your neck muscles, your shoulder muscles, and they are great for short periods of time, but often they fatigue very easily compared to the diaphragm that can go for much longer.
Yeah.
So, those faster fatiguing muscles are going to get you into problems if you rely on them too much.
So I guess that's more important for endurance athletes rather than, like, your sprinter can probably cope with a bit of chest breathing for the short amount of time that they need to do it. But it's the
Yeah,
more endurance sports, I guess, that become more chronically problematic in terms of
yeah,
their
you go.
breathing
We see
patterns.
Yeah, those sports that have a lot of high ventilation load, then are the ones that we tend to see. Not
Okay.
exclusively. Yeah.
Yeah. And so we've talked a little bit about what poor breathing patterns might look like. So let's just move on to discuss what a good breathing pattern might actually look like. So what are the things that you're trying to achieve with these patients?
Yeah. So I mentioned before about looking at the pattern at rest. And although often people will describe to me that they feel their breathlessness more during activity, I'm always very keen to see how they breathe when they're not moving around. It's a really good starting point. So a lot of the time, my assessment will be about educating the person on how you should breathe and how they're breathing at that moment. So then they can go away and have an awareness and establish how do they breathe in different scenarios. Because often you can imagine when a respiratory physios, you know, stood or sat next to you and says they're going to look at your breathing, suddenly the breathing
Yeah.
can change. And
Changes.
yeah, right. So you have to be mindful of that. So, it's a very educational process. And very simply, I'll be looking, and we use a tool called the breathing pattern assessment tool. It's a really simple tool that healthcare professionals use. And basically, we are looking at the person's breathing, sitting still, ribs relaxed, sort of chest, upper body relaxed, sitting back on a chair. And you're looking to see, are they breathing through their nose or their mouth? Now, sat still, we should be able to breathe through our nose. We can talk more about nose and mouth breathing and when and where's a good time to open your mouth to breathe. But essentially, it should be your nose while you're sat still. The breathing should be quiet. You shouldn't really be able to hear any noise both on the in and the out.
Yeah.
You should be, and that's where you can we talked about that upper and lower rib cage breathing. So we get either the therapist might place their hands, or the person themselves can have a feel of it. One hand on the upper rib cage, one hand on the lower rib cage, which is sort of over your belly button area. And you're feeling to see what's moving. And while you're sat still, it should just be the lower hand, the lower rib cage that moves.
It's
And the
moving.
movement isn't very big. It's just a little puff up of the stomach as you breathe in, and then it comes down as you breathe out. And at the end of it, there's a slight pause. And none of this upper rib cage should really be getting in on the
Be
action.
moving.
It's not required. Your metabolic requirements don't need it at that stage. But there's more. You could count how many breaths you take. And so the frequency of breathing when you're sat still can be between 8 and 12. So And you're also looking for the rhythm. Is it nice and rhythmical? Or are there some extra breaths that get thrown in? So people often sigh or yawn or take a big, deep breath where they're trying to search for that sensation of getting a full breath. And they often say that to me, I can't get a satisfying breath. So that
Yeah.
starting point is great at really establishing, well, how do you breathe when you're not moving around? Because you can
Yeah.
imagine that's going to be important for recovery too, as well.
Yeah.
And then things get more complicated as you move around, because obviously that then does become partly due to fitness, as we sort of said, in terms of how frequently you breathe
Yeah.
and what you're
Yeah.
doing, right? But we know the optimal pattern as someone moves around is the rib cage opens up and the size of the breath gets bigger. And then eventually your breathing rate follows with that. It gets faster. And we're looking, when someone's exercising, we're often getting them to do their exercise, and then we'll ask them to stop, and we'll be able to have a good look at what is moving. Is it that lower rib cage? Is there too much shoulder movement? How does it sound? Are they getting is there a nice rhythmical breathing rate? Yeah. So there's plenty for us to look at, as you can
Yeah.
imagine. Just
And
described.
I've been sitting here doing exactly what you've just looking, just trying to think, am I breathing through my nose? Am I breathing through my mouth? Just making sure that I used to do a lot of music. So I have in the past done quite a lot of diaphragmatic breathing. And obviously as a physio, as I used to be a physio, we used to see patients on wards and things. And so it is bringing back lots of
Mhm.
memories of how you should be breathing. No, it's really interesting. But I guess also, a question I was going to ask was, how do you find that often people's sort of resting breathing is normal, and it's only once they start exercising that the pattern goes a bit erratic? Or do you find that people who have an erratic sort of breathing pattern when they're exercising also tend to have a slightly erratic breathing pattern when they're at rest?
You know what? I see everything. I see both.
Okay.
I see
Yeah.
those that have not great breathing patterns at rest, and then it just gets worse as they move around. I see
Yeah.
people who have great breathing patterns at rest and then not so much good when they're moving around. And then those that have a bad breathing at rest, and then once they start moving around, it actually gets better.
Ah,
Yeah,
okay.
because the body starts to match what the person's doing. So when someone says to me, well, once I get into my running and once I get going, it sometimes feels easier, it feels better. And again, my brain's going, okay, that's interesting. That tells us a little
Yeah.
bit.
Okay. Okay. That's so we're also going to just talk a little bit about over breathing, sort of like hyperventilation type patterns and performance, and I guess the effects that will have on an athlete's performance.
Yeah, breathing too fast, too soon can be really detrimental to an athlete's performance. And essentially, that's what we're talking about when someone is hyperventilating, is
Hmm.
when someone is breathing in excess of what their body needs. Now,
Yeah.
there's lots of reasons why that might happen, but the consequences are, the function of breathing is we breathe in oxygen, we breathe out carbon dioxide. And the key issue with breathing too much is you can't actually fit any more oxygen in your body. Your body's really good at carrying around as much oxygen as it possibly can. But unfortunately, you might breathe out too much carbon dioxide, which means your carbon dioxide levels change inside your body. And this has a real significant systemic effect. And what I mean by that is that it can affect blood flow for different areas, potentially to the muscles, to the periphery, to the brain in terms of concentration. It also heightens your sensation of breathing, so you actually feel more breathless. Your chest can tighten up. You can feel dizzy. You can feel lightheaded. You can feel nauseous. All the things that would hamper a performance.
Yeah.
It's a nice feeling.
Okay. So again, the idea is to try and slow your breathing down as as an athlete, and think about that sort of slightly deeper breathing patterns. Is that some of the things that you kind of encourage your patients who come to see you?
Yeah, yeah. It can be quite challenging when you exercise to slow your breathing down. So often we're trying
Mm,
to find why they're breathing too fast. What's the reason behind it? So during my assessment, I'll be really looking at the biomechanical. Is there anything around their rib cage, because you can imagine your lungs sit inside a bony structure that attaches onto a part of your spine that if you sit a lot during the day gets very stiff, as we all know
Yeah.
our spines get stiff, right? And your
Yeah.
ribs attach onto that. And so often what I sometimes see is just that the ribs don't move. And if your lower ribs don't move and your back is very stiff and your volume of the size of the breath doesn't open up as you move and go through your exercise, what tends to happen then is the breathing just gets faster. So it's not until we open up that rib cage that then the breathing can be slowed down. So
Yeah.
sometimes it's not just about slowing it down. You've got to be thinking maybe they need some more space at the bottom to slow it down.
Okay.
However, you've then got the idea around, if people believe that they need to get more air into their body, our beliefs and our thoughts are very powerful, aren't they, with our body's physiology?
Yeah,
So if
absolutely.
you feel like you should be breathing faster and you're trying to push more air through the lungs or faster, that can obviously, be detrimental too. So our thoughts and what we're feeling, you know, might need to also be addressed.
And I guess that's a lot of the educational side of things that you
Yeah.
work on, the education, the reassurance,
Yeah.
patients sort of just needing to have a better understanding of their body and their body's oxygen needs. And yeah, and that I guess will also kind of help in terms of that pattern of breathing.
Yeah, yeah. Because I think, breathing's automatic. We rely on our bodies to get it right. And so this respiratory center that's in the bottom part of your brain is controlling and it's getting lots of messages from absolutely everywhere. And sometimes it doesn't always get it right because of exactly all those different environmental reasons or internal physiology, lots of reasons. So yeah, I think that, it is really great that we're talking about breathing to raise awareness of what optimal breathing looks like so we can start to really help athletes breathe more efficiently and recognize perhaps when they're not.
Yeah. Yeah. And so if have you got some kind of quick wins that people that can try at home? I mean, it might even be listeners aren't necessarily kind of high performance athletes, but even the sort of recreational athlete, what sort of things should they be looking at to try and improve their breathing patterns, I guess?
Yeah. One of the things that I didn't mention earlier, which we probably just need to bring in, which is to answer your question, is the power of nose breathing. Now,
Okay.
yeah. So one of the other reasons why people might breathe too fast, too soon, is because they are someone who predominantly breathes through their mouth. The mouth is incredibly easy to breathe. The hole's bigger,
Yeah.
usually, it can come in and out much faster. And usually it will come in pathway of least resistance and it'll go to the top of the chest. So coming back to your question, what can people do is really see if they can help their bodies to breathe through their nose for as much as they possibly can, for as long as
Okay.
they feel comfortable. So I say to people, look, you know what? Try and breathe through your nose unless you're talking or running at fairly high intensity running or moderate to high, or it doesn't have to be running, any other, something that makes you more breathless, then yes, very much mouth breathing can be the right thing to do. Otherwise, you've got to try and keep your mouth closed. So the power of the nose has lots of potential to slow the breath down. It connects better with the diaphragm. The volume of air comes in, goes into the right place. And it's a very natural way of slowing it down. So it might be during exercise, in through the nose, out through the mouth, feels like you're able to do. You might not be able to do it on every one, but that ability to use the nose to potentially slow the breath down can be helpful. Having said that, I do sometimes see athletes really trying to pull the air in and out through their nose because they've been told to breathe through their nose because how brilliant nose breathing is, for lots of reasons. And it just looks like it's overcooked. They're,
Okay.
they're really pulling it in with their accessory muscles. Okay, at some points that the body maybe would be better if you opened your mouth.
Yeah, okay. That's really helpful. And then also, we have touched on this a little bit in terms of slowing the breath, so actively trying to think
Yeah,
about slowing your breath.
yeah,
And
yeah.
so how might somebody do that?
Yeah. So often when I'm helping someone with breathlessness, I'm trying to make their breathing more efficient and trying to help them slow it down. I don't want them to slow it down too much, right? Because,
No.
we want their respiratory centre still to be able to deliver and keep the body in what we call like a homeostatic state. You know, the oxygen's coming in and supplying it to the muscles. We slow that down, it's not going to feel very comfortable, is it? So we have a tendency when we are out of breath to want to pull more air in. It's innate in us. It's human, ability to. It's the frontal cortex. It's that cognitive part of the brain going, I need to breathe more. So a lot of focus goes on the in breath. And so what I'm telling athletes is actually you're better off focusing on the out breath. So if you could just shift your mindset to the breathing out
That's
part
clever.
of the
Yeah.
breathing cycle. And sometimes we might use pursed lips, or we might just say to them, breathe out just for a fraction longer. Not too long. No, you don't want to, again, we don't want to overcook it. Don't want to try too hard. We're just trying to help the respiratory center just to slow down. And you can imagine you make that out breath just a little bit longer, then the whole breathing cycle might be more like I don't know, 40 breaths per minute rather than 50 or 60 breaths per minute, which is sometimes what we see when people are at the
Gosh,
top
yeah.
end of exercise, which is super fast.
Yeah. No, that's really helpful. That's a good tip. And we also talked a little bit about the being aware of the diaphragm. So being aware of opening up the bottom part of your chest. So again, how, especially when you're exercising, it's all very well kind of putting your hand on your chest in sitting and at rest. But, is that something that you would recommend they do if, say somebody's running, just to kind of give them that feedback, just pop your hands on your chest for a minute or two and just think about your lower breathing? Or what are the tips that you might give somebody to do that?
Yeah, definitely. So I'm forever wrapping exercise band around the bottom of people's chests to give a little bit of feedback. But there's lots of different things depending on whether you wear heart rate monitors or for females that wear where your bra sort of sits. So there's different ways to get some feedback. But while say if we just talk running, it's a little bit easier with cycling. There's a lot of movement, isn't it? Everything's sort of juggling around. And so that can be quite challenging to feel whether the lower rib cage is moving. So sometimes I have to shift their attention to actually what I don't want them to do. So if they can sort of sense that the shoulders are literally going up and down, then the cue might be, and this is where you have to work with the athlete and decide what cue works best for them, what's going to help them. Is it dropping the shoulders that then allows the bottom of the rib cage to come in? Is it about trying to slow the breath down, which then gives more time for the breath to come in? Is it about making their breathing just a little bit quieter, bringing the breath in just a little bit more slowly off through the nose, like we said? So it's about, to get that lower rib cage movement, it might be about making sure that they fully empty the lungs so that the diaphragm can come back up to its starting position.
Yeah.
So fully breathing out, fully breathing in, and keeping the shoulders relaxed as possible.
Okay. That all sounds very good. So let's try and just think about the final takeaways, maybe that would be good for people to think about from this episode. So I've got a few questions, if that's okay. What do you think is the biggest breathing myth?
More breathing gives you more oxygen. Because most of us are sitting here with oxygen saturations of 98%, which is pretty where you want them to be. Your oxygen hemoglobin is fully saturated. Breathing faster or deeper in that scenario is not going to fit any more oxygen in. But that's often what people say to me, is they don't feel they're getting enough oxygen. So I have to dispel that myth or that myth.
Yeah. And one habit that makes the biggest difference, do you think?
Breathing through the nose more.
Okay.
As long as it feels comfortable, breathe through your nose. Close your mouth.
Okay. And finally, who should seek help and where should they go? I think, where would you signpost somebody?
Yeah. I think if anyone's feeling breathlessness during exercise that doesn't feel quite right, then 100% go and see your local doctor initially. But equally, if maybe they may have already done that, they may have already been given inhalers, they may have already gone down that road, then at the Institute of Sport, Exercise and Health, come along and have a full respiratory assessment that will enable us to really delve down into why they're feeling, the breathlessness, and be able to help them, guide them through it as the best possible way.
Okay. And how easy is it for them to access that service?
Yeah, they can self-refer in.
Okay.
Yeah, definitely. I'll ask their GP to refer them in if they, or get another doctor to come in
Great.
to see us. But yeah, anyone can come up and see us on Tottenham Court Road in London.
Great. Well, Julie, it was lovely to speak to you today and some really useful insights. I have definitely been sitting here thinking about my breathing a lot more. So hopefully it will help with my running and various other sports that I do as well. But it's been really interesting. So thanks ever so much.
Brilliant. Thank you very much, sir. Let me come on and talk about breathing.
Great. All right. We'll speak to you soon.
Thank you.
Bye.
Bye-bye.
Thank you for listening to LBSM's Ask the Expert series. We really hope you enjoyed listening. If any of the topics discussed are relevant to you or you want to find out more, please get in touch by phone, email, social media, or visit our website. Thanks again and see you soon.